one dose of the vaccine. The 14-day positivity rate has now dropped to 5.2%. This is significant because in my facial covering order, we had two different milestones to achieve the point where we would no longer recommend the wearing of masks. One was, of course, to reach the 50% threshold where we would remove the recommendation for wearing of masks outdoors. And we said once we reached the milestone of 70% of the eligible population of having received at least one dose, we would recommend a removal of facial coverings for everyone. Or we said that if we got to a point where we had a sustained 14-day positivity rate of 5% or below for 2 weeks, that would be another pinnacle. And it appears that we will reach that sometime in the very, very near future. And if you have questions, Dr. Pino is the epidemiologist, and he will be glad to respond to those questions. As a reminder, both the FEMA-operated vaccination site at Valencia College West and the state-supported vaccination site at the South Trail Branch Library will have operational changes beginning next week. The FEMA-run Valencia site at Valencia again will close on Tuesday, May the 25th. The South Trail branch will stop administering first doses on Wednesday, May 27th, and only provide pre-scheduled second doses. The Orange County Convention Center COVID-19 vaccination site permanently closes on May the 21st. For a list of other available sites in Orange County, you can visit our website at ocfl.net/vaccine. As far as other vaccination sites, Orange County still has 4 recreation centers that remain vaccination locations. The Magic Gyms, we call them again, are open 6 days a week from Tuesday through Sunday, so they are closed on Mondays. The drive-through Barnett Park vaccination site operates 7 days per week, and to help promote hurricane readiness, staff at each of our vaccination sites will distribute 25 weather alert radios each day for 4 days beginning tomorrow through Sunday, May the 23rd. Radios are first come, first served for Orange County residents only. A valid driver's license is required to pick up a weather radio. Again, you can get information about this opportunity at ocfl.net/storm. Also, I want to remind you that if you are a senior citizen, a person 60 years of age or older and have some type of medical infirmity, you are able to reserve free rides to the 4 recreation center vaccination sites by accessing links. And in order to do that, we are suggesting that you can contact 311 here within Orange County, and they will connect you with the Office of Emergency Management and work with Access Links to schedule you at least 48 hours in advance for a ride to those 4 recreation sites. I also want to acknowledge for 14 months, the state of emergency officials, along with the Florida National Guard, coordinated and staffed a COVID-19 testing site at the Orange County Convention Center. At any one time, there were some 200 individuals running the state-operated site, which was open 7 days a week. The site closed Sunday, this past Sunday. From March the 25th of 2020 until May the 16th of 2021, a total of 488,852 tests were conducted at the Orange County Convention Center. So nearly 500,000 tests were conducted there. If you are looking for a new place to get a COVID test, Barnett Park remains a good option for anyone. It's a drive-through site location. The site is open 7 days a week between the hours of 9 a.m. and 5 p.m. And now, let me go to a special award that we want to present today. Today, along with Dr. Pino, we want to present Janice Rindle with Orange County, the Orange County Public Health Hero Award. Now, let me tell you a little bit about Janice. Janice is an Orange County employee who serves as an event manager at the Orange County Convention Center. But during the pandemic, Janice managed a different kind of event. She was managing the COVID-19 mass vaccination site at the Convention Center, and we want to recognize her for her dedication to service and the community. For 5 months, 6 days a week, she helped to plan and organize the use of the Convention Center North Concourse for the first COVID-19 mass vaccination site in Orange County. In fact, one of the first in the region. Janice became an indispensable daily resource addressing problems before they disrupted the operation. She also took on the unofficial challenge of feeding the troops, coordinating with numerous hotels, restaurants, bakeries, and food trucks to feed the 200+ staff it took to run the convention site each day. This feat alone had a profound impact on the staff's morale. You know, they had to be nourished in order to provide service to others. Simply stated, a large portion of the credit for the great success of the joint Orange County government and Florida Department of Health COVID-19 mass vaccination site is due to the dedication, determination, and personal drive of Janice Randall. She is a shining example of a civil servant, and she truly deserves the honor today. So.
Just get a little bit closer, Dr. Pino, hop in there.
All right.
Good looking people to know. Hold that up so we can see it. There we go. Look happy. Thumbs up. We love thumbs. Nice. Thank you.
All right. Thank you, Janice. And Dr. Pino, now I'm going to turn it over to you.
Good afternoon, everyone. You know, last week we introduced you to Deborah Collins from our department, and now we introduce you to Janet. And those, Janice, those are the heroes behind the well-functioning machine that was established at the convention center. And they are not sure of prices to Janice, but her sacrifice and her dedication allow us to be able to do our work. And she did it without complaining, without any objections, and her job was to remove obstacles for us to be able to do our work. And it's complicated because it goes from electricity to drainage the water, to having the temperature, to protecting against the rain, to having the food. It's just everything. So Janice, thank you very, very much. And we said to Janice, if Orange County doesn't want you, we will hire you. I said that to her. So for the numbers today, I mean, the county could not be in a better position. Today, our positive rate is 3.4, and average rolling, the mayor mentioned to you, is 5.2, and that is only with PCR labs results, because for this calculation, we don't use rapid. So even with rapid, it would be lower than that. So this week could be the first week that we are below 5%. At the end of the week, we will know if that is the case, but following the trend, everything has been below 5 for the last few days, so the week should behave the same way. So more likely either next week or the week after, we probably will reach the milestone of 2 consecutive weeks at less than 5% if nothing changed in the dynamics. Also, another positive news, our recovery rate went up to 98%. We cannot do better than that. Maybe we will get to 99, but before that, probably we will be done with the whole pandemic thing. And the number of deaths, as the mayor mentioned to you, is 1,288, and it's a sad reminder that even as we succeed, there are people who continue to experience negative health outcomes in this pandemic, and those people continue to be needed to be protected. And we always think again about individuals in long-term healthcare facilities, individuals with high risk health conditions that for whatever reason may not be able to get vaccinated. And it is important that we as a community protect those individuals. The additional 7 deaths were 4 female, 3 male, 3 black and 4 white, 2 Hispanic, 5 non-Hispanic, 4 have pre-existing conditions. 1 death was from September, the other 6 are from May, and only 1 of the 7 was reported in a long-term care facility. With regard to the variant cases, our total is at 673, and we do not have any new hospitalizations or any new death in any cases of the variants that we know. With regard to the breakthrough cases, we are up to 273 as far as we know. With regard to the vaccines, just to give you an overall number, in our county we have given 1,104,190 shots since December 26. And most of that went to Orange County residents. Only 85,106 were given to non-residents. And I again remind people that many employees in our county do not live in the county, and that will explain some of those numbers. Just to give you a little bit of perspective, our Orange residents with complete series, people that are fully immunized, it is up to 34.18 of our entire population. So 34.1% of our entire population have been fully vaccinated. When we talk about people who are 65 years and older, that percentage goes to 76.2. 76.2 of all people over 65 years old have been fully vaccinated in our county. With regard people to under 18, we continue to make progress, although we would like to see more of that. So far, we have vaccinated 20,646 people under the age of 18. And that is a low number. Of course, we just recently started with some of these ages, and it will go up. But for example, for people between 12 to 15 years old, we have about 37,000 in that category. So these are numbers that need to continue to increase. And for the total number, overall numbers that we are following, and again, this is 16 plus, we are not calculating yet for 12 to 15. So 16 plus, 51.2% of the entire population has been vaccinated in that age group, and also 41% of that age group are fully immunized of the people over 16 years old. I also would like to remind people that as the travel season begins, summer also, that means mosquitoes. And we need to protect against mosquito-transmitted diseases. Those are important diseases to protect against. So wear your long sleeve, watch the hours that you go out, use repellent when you can, and please keep your patios clean and drain the water so that we don't offer a place for the mosquito to breed. Mr. Brown?
Thank you, Dr. Pino. Thank you, Mayor. It's an honor for you all to be here. I got to go downtown a couple of times, but I'm happy that you all are able to come out here and, if nothing else, see the artwork that we have on display from our employees. Dr. Pino, I've listened to you just about every day at our 1 o'clock call, and you have a facility with numbers that is underrepresented, unestimable, I think, with the ability that you deal with the numbers. But I'm going to complicate the message today because I'm going to talk about some other numbers. I'm happy to report that this past weekend, Orlando International Airport recorded some of its largest non-holiday crowds since the start of the pandemic. And just to be clear, so everybody understands, because as Dr. Pino will tell you, sometimes the numbers aren't as clear as you would like them to be. The numbers that I'm going to talk about are departing passengers that are screened through the TSA checkpoint. And from that perspective, we get a report every day. It's issued nationally from Transportation Security Administration that tells us what the top 100 airports in the country have done. And for the months of December, January, February, and March, Orlando International Airport was the busiest airport when you look at that metric. What that doesn't include is the connecting passengers that you would see in an Atlanta, a Charlotte, a Miami, or a Dallas-Fort Worth. So what we've looked at over this past weekend is departing passengers on Saturday, over 60,000 passengers. That's a non-holiday weekend. Our busiest over the Mother's Day was busier than that. But this past Sunday, we saw 66,000. Now, I'd like to tell you we were the busiest airport over the weekend, but what we're seeing nationally is that passengers are starting to fly. So the airports that you would expect to be busy, like Los Angeles and Dallas-Fort Worth, are coming up. So they're catching up with us. But having said that, we're getting back to where we needed to be when you look at our 2019 numbers. Now, when I compare it to 2020, we've probably increased 1,700%. That doesn't give you much. A year ago in April, we had the worst traffic that we've seen in a long time. In fact, for the month of April, when you compare this April to last April, we had a 1,700% increase. But if you go back and look at 2019, we're at about 76% of where we were compared to the 2019. So we're making progress. Took a look at the numbers this morning for the first 2 months of May, the first 2 weeks of May, and we're about 80% of where we were. So you can see we're starting to come back, and we expect the summer season to be very busy. Virtually all this traffic has been domestic traffic. Our international traffic has been lagging, but the good news is for European travelers that the European Union officials met this morning, and they've agreed to relax their rules for passengers flying in and out of the European Union. Now, in order for this to work, our government, our federal government, is going to have to work with them to do that. But what that does for us is give us some indication that we're going to start to see international passengers come back to Orlando International Airport. Historically, our traffic internationally has been driven by the British and the Brazilians. I think the Brazilians probably will lag a little bit because they have a lot more challenges right now than the European Union. But we're expecting to see in the summer some increase in flights. We already have schedules from British carriers and European carriers, and we're hopeful that we're going to be able to reach an agreement with them at the federal level so that those folks can start flying back into Orlando International Airport and enjoy everything that we have to offer. And one of the major things that we have to offer is the ability to tell these passengers that we're safe and secure, and that's due in major part to the efforts of Dr. Pino, Mayor Demings, and the Orange County staff. I would like to particularly thank Janice, because both my stepson and my wife were able to get vaccinated at the Orange County Convention Center, and my wife was amazed because she was in and out in 7 minutes. And this was at 6 o'clock in the afternoon. So my personal thanks to you for that, because she was very happy when she got her vaccination. So I think in closing, we're starting to see a lot more green shoots. I told that to some airport executives who were here last month, and we're starting to see more traffic, and we're ready to handle that traffic. Our folks during the pandemic, because our operations people have been showing up every day for work. Our first responders have been showing up every day for work. And our maintenance people have been showing up every day for work, because it's hard to Zoom maintenance. I don't know if you've ever tried that, but if you try and Zoom maintenance on a call, it didn't work too well. So these people have been coming in, they've been fixing up the airport, they've been getting ready for the traffic return, and we believe that we're on the verge of having a very robust summer, and we're looking forward to being busy once again. And again, thank you, Mayor, Dr. Pino, for all that you've done. Just a reminder, we are under federal mandate, so in the airport, You still wear a mask. We have relaxed social distancing based on the CDC, where we can move from 6 feet to 3 feet, and you'll see that when you look at the queue. But until we get direction otherwise from the Federal Security Director or the Administrator for Transportation Security Administration, everybody in the airport is going to be required to wear a mask. It's safe, it's responsible. What we don't want to see happen is a relapse and go back to where we were a couple of months ago. So I thank you all for being here. Hope you enjoy the scenery, and we appreciate everything that you, Dr. Pino, and Mayor Demings have done to make this a safe place to work, live, and travel. Thank you.
All right, thank you to Phil Brown and the entire staff at the airport for hosting us here today. What we're going to do is open it up for questions. In the way of instructions, I'm going to start on our left today, and then we'll work on my left, your right. We'll work to your left. And if there are any questions in Spanish, we have Ilia Torres, who I will ask to come up and to assist with interpreting for me. Of course, Dr. Pino is fluent, and so it kind of looks a little odd because typically at County Administration, Lauren Seabrook would be on the front row, and she found her way to the front row again today as well. So we'll start to my left again. And so today, Steve Hudak from the Orlando Sentinel gets to ask the first question of any of the speakers that are here today.
Well, I do have a couple of questions. I'll direct this to Phil Brown, but Dr. Pino or Mayor, you can weigh in on this. So things seem to be getting back to normal. So
Whatever that is.
Yes, and that was my question. What is it going to be? And what's the new normal going to be?
Well, I mean, if I knew all of that, Steve, I wouldn't be working right here. Now, I think things are going to change. They're going to have to. The virus is not going away. What we've been able to do is find a way to get immunized from the virus. So we're going to have to, I think, continue to take precautions until everybody is to the level that you don't have the threat of the virus. So I think what's been proven by all the effort over the last 14 months is you approach this in a measured, scientific way, and I think that's what we need to continue to do. We need to observe the science, adhere to that, and make sure that everybody's safe and protected. So I think, at least until we get direction otherwise, people that in the airport will be wearing masks. We will probably have social distancing. We're not going to relax any of our cleaning. So I think you're going to see that just as you saw it after 9/11. You know, air travel changed after 9/11. It changed pretty significantly. I think you're going to see a shift in the way people travel now, particularly on aircraft, and there just have to be a lot more cognizant of the issues relating to viruses and the transmission of viruses.
You know, the only thing I would add is probably irrespective of whatever the government does in the way of mandates regarding the wearing a mask, people are still going to continue wearing facial coverings, especially when they're flying. We saw people wearing facial coverings before the pandemic on airplanes, and I believe that you're going to continue to see that because people will just feel that that's something that they have to do to protect themselves. So I think that will be the new normal. So with that, we'll go to the next question.
Lauren Seabrook, Channel 9. My question's for Dr. Pino, and then Mayor, if you want to chime in as well to this. But Dr. Pino, it's been 15 months since all of our lives were turned upside down, and I know it's been a big, heavy burden on your shoulders for all that time to protect our community and essentially save lives. So I'm just curious if you're sleeping easier these days, how you personally are feeling about where we are at here in Orange County.
Sleeping better, not waking up in the middle of the night thinking what needs to be done. But things are going the way that we have planned. I think we talked to you a few months back that when the mass vaccination campaign passed, and we are about that point that the mass vaccination is not the response. Now the response is going to be those smaller vaccination sites offering few vaccines to those who may want it. And with regard to the pandemic, the next phase is going to be containment of outbreaks that may happen among people who are unvaccinated. So that's what we have to watch now for. How can we quickly respond to small outbreaks so that we can control transmission within vaccinated people, unvaccinated people? And that's going to be our next phase. The numbers are going to continue to increase very slowly, but we also now are in a phase that we would like to see vaccinations happening at the point of care, so that you at your provider's office can get the vaccine that you need, because now the numbers are not as large as they were. It's a relief for us in the sense that all our work has been on suspension for the last 15 months. Everything else that we do has to be put aside so that we can respond to this pandemic. And we are happy to go back to work, to our regular, but also now we have to deal with all the issues that have increased, left behind, accumulated, that we have to take care of. But very happy that this phase is finally getting to an end.
Kelsey Thord with West 2 News. My question is for the airport again. I know you said that the level of passengers that we're seeing right now is about upper 70s compared to what it was in 2019, and you said you're pretty hopeful about the summer. Do you think this summer we will see it finally get back up to the equal numbers of what we were seeing in 2019? And if so, when do you think that's going to be?
I think that we'll come close to that, but there's still a lot of issues to work out. Part of what's going to happen is we're really going to have to see, I think, some change in the international traffic. The domestic traffic is strong, but domestic traffic has always been driven, for that matter, international traffic has been driven by the attraction of Central Florida. So some of it will be, the factors are will there still be demand to go to the parks? I personally think there will, but there's, it's difficult to predict. So I think we will be very close to 2019 numbers in terms of the absolute numbers. Airlines are increasing their flights. So we have as many flights and seat capacity, the actual number of seats in the market, we're already approaching where we were in terms of seats. The difference is the load factors are not as high. So I would expect by September, August, or September, October, we'll see how close we're going to come. Having said that, there's some challenges from the financial standpoint that we're sort of lagging in some of our concessions because they're having problems hiring people, so they're not doing as well as they were in 2019. So we're going to see some hiccups along the way in that. But I think hopefully by the end of the calendar year, I would say, by December, we should see something close to where we were. But it has to be on a sustained basis. So we've got some ground to make up. Right now, we're just talking about on a month-to-month comparison. To me, it's going to be on an annualized basis as to where we are going to be able to get to 51 million. I don't think we hit that number, which is where we were on an annualized basis in February of 2020. I don't think we probably hit that number until 22, 23.
Okay, this is Melissa Thomas with Florida National News. This question is for you, Mr. Brown, as well. I did want to ask you, as it relates to the actual airport staff, like the folks that are under your purview, what do you feel was the biggest adjustment for them, and how has the change been now that the vaccines have been made available to everybody?
Well, I think the biggest change originally was people getting used to social distancing and wearing masks. I think we all had to get used to that. And then just behaving in a civil manner. That's become a problem. I think you will see some reports from Federal Aviation Administration that people that have been flying, that they've had to levy more fines in the last 14 months than they have probably in the last several years. So some of that I think is anxiety. Travel for a lot of people induces anxiety. But I think the biggest change is being able to work with a mask on, be able to observe social distancing. But beyond that, when you go home, to make sure that you're safe there, because a lot of what we saw in terms of infections was community spread. It wasn't necessarily generated at the airport. Some of it may have been, but it's really that you have to be very disciplined throughout the whole day, all 24 hours.
Nikki Zizazo with News 6. This question's for Dr. Pino. Dr. Pino, you shared some really promising numbers in terms of us being around 5%. And what's on a lot of people's minds right now is with numbers looking so promising and this guidance we've received from the government in regards to those who are vaccinated should wear masks and so on, is there any level of concern in terms of, because some people may, because this is by, the honor method, is there some concern that we are going to see kind of a seesaw effect and we may wind up where we were a few months ago if people are not compliant as they should be, as, he mentioned with more people flying in and out in this area? Is there a concern about that? Is there a plan in place?
So part of answering the question to Lauren and our ability to detect quickly and contain small outbreaks goes along with what you're asking. And our ability to respond to those outbreaks when it happened, because they are going to happen. There is no question outbreaks will happen. How large, that's another question. It will depend on our ability to respond. Now, with the high number of vaccinated people, over 50%, and we know it's higher, we know that we are underreported. I believe that the real number is going to be around 57, 58% of our population when we get numbers from the VA and the Department of Defense. With that high number, it's very unlikely that we will see very high highs. I think that we could see some oscillation during a time period, but those are going to be very small, we hope. And that's why also we are moving so aggressively in addressing vaccination at the schools, because that's one of the congregated environments that we are most concerned about in the future, and for the ability to the students to return to school so that the parents can also return to work. So it's a double whammy in the sense that we have a segment of the population, children that have not been vaccinated, that we know they can acquire the disease. So you could see some outbreaks in that segment of the population that has not been vaccinated. Our ability to respond and contain is going to determine how big those outbreaks get.
Amanda Dukes from West 2, and Mayor, my question is for you. It sounds like we could be moving into phase 3 in the next couple of weeks. Can you just remind us what that's going to mean for the community, the specifics of it?
Yes, after we consulted with the scientists, the medical professionals, the Centers for Disease Control, et cetera, one of the things that they said was that when a community reaches that herd immunity, typically you should see the day-over-day positivity rate of 5% or below. It means that you have significantly contained the virus within your community. And given the projections that Dr. Pino and others had with our incremental improvements day over day as new individuals were being vaccinated within our community, we knew a certain progression would occur. When we would get to the point where we would call it phase 3, that would be the phase in which we had a sustained day-over-day positivity rate for 2 weeks of 5% or below. That would mean that whether you would be indoors or outdoors, it would be recommended that if you were fully vaccinated or, as a matter of fact, no one would be required to wear facial coverings. So it was 70% or the 5% or below for a sustained 14-day period of time. So it appears that we will hit the sustained 5% or below prior to us reaching the 70% pinnacle. So it's a benchmark. It was guidance, guidelines that we were giving to our community, which is somewhat consistent with what we have now heard through the Centers for Disease Control. I do remind you that the president has said that his goal was to ensure that all Americans would hopefully not have to wear facial coverings by July the 4th. Across America will likely reach that benchmark as well. we still have to get through the Memorial Day period of time, a holiday. And if people continue to at least be respectful of one another, respect the virus, and protect themselves, if you have not been inoculated, and wear a mask, watch your distancing, and do all of those things, we should certainly reach that pinnacle where no one will be required to wear a mask on or before that July the 4th date that the president laid out for all of us. So our community, if we work together, we can get to that point. Okay.
Question in Spanish for Telemundo. My name is Edgar Carrillo. For Mr. Brown, with the help of Ms. Torres.
And so we're going to have Ilia Torres come up. Also, Commissioner Gomez Cordero, I thought I saw somewhere. There she is over there. She joined us as well. So Ilia will translate for Mr. Brown.
Okay, la pregunta tiene que ver con las vacunas o un pasaporte de vacunas, como se le ha llamado. La pregunta tiene que ver con el llamado pasaporte de vacunas. Todas las personas que hemos viajado durante el último año hemos visto cómo es un contratiempo buscar un COVID test before y también al regreso, when we come back from traveling. Es una solución el pasaporte de vacuna o la prueba de que estás vacunado para evitar este contratiempo y también para hacer los viajes más seguros, y cómo van las conversaciones en torno a esta solución.
So the question from Telemundo. Sure thing. The question from Telemundo is, we have seen the so-called vaccine passports. When you travel, we understand that it's cumbersome for travelers to obtain a negative COVID test to travel back and forth. Would you suggest or think that the COVID-19 passports are a solution to overcome that cumbersome or problematic to travelers? And what has been the discussions regarding this matter?
Let me start with the discussions first. The governor, in an executive order issued last week, pretty much discussed it, and he has dictated or mandated in his executive order that in Florida you will not have a requirement for a vaccine passport.
El gobernador, mediante orden ejecutiva, ha adoptado un mandato de que no se aceptarán pasaportes de vacunación en el estado.
Ultimately, the decision for those kind of health protocols don't lie with the airport, but with health officials and the governments.
Últimamente, esas decisiones no recaen sobre la autoridad de aviación, sino que recaen sobre las agencias de salud.
So in my personal view, in order to be effective,
en mi opinión, para ser efectivo,
there has to be some meeting of the minds about how easy it is to demonstrate that you've had your vaccination.
Tenemos que tener una discusión y un intercambio de ideas de cuál es la manera más fácil de demostrar que usted ha recibido la vacuna.
Or the appropriate test that shows that you're negative.
O el correspondiente examen que determina que usted está negativo al virus.
There are technologies that can do that. Some have already been proven.
Hay tecnología existente que puede detectar eso, y hay algunas de esas tecnologías que ya están siendo probadas.
But it's going to have to be the meeting of the minds for health officials and the government to establish those protocols and how they're administered, so that they're administered fairly.
Tendrían que llegar a un consenso las autoridades de salud y de los gobiernos sobre los protocolos a utilizarse y las tecnologías a utilizarse.
Gracias.
Mr. Brown, are you starting to see more of the airlines adding more flights? I've noticed just in trying to book family vacations and whatnot, there's still a lot of flights that aren't back here out of Orlando. Do you know when we'll start seeing more flights added?
Well, I think the key for the airlines is where they think they can make revenue. And you have some airlines, and I can name them: Spirit, in Orlando has been growing very rapidly. They've been adding flights. Frontier, so Frontier advertises pretty low flights. Southwest has been picking up, but some of the what we call the legacy or network carriers have not been as fast. So it's going to be uneven because some of these airlines are having to change their business model. As an example, Delta, United, American, all focused on business travel and international travel. Well, clearly, business travel has not recovered. The travel that we've seen here, and the reason that I think we've been leading the country to a large degree, is because we have a large proportion of our travel that is leisure, and that's been very resilient. It was proven in the recession in 2008. It's been proven again here. So I think you will start to see, as the opportunities present themselves for airlines to capture that, some, such as United, are changing their focus more from business to leisure. But the airlines that have already started that, the Spirits, the Frontiers, the Southwest, are going to continue to grow as long as there's demand in the market. My own personal view, there's a lot of pent-up demand, and it's a matter of being able to take advantage of that and establish that you can fly safely on these air carriers, and that both the origin and destination airports are safe to travel.
Mayor Demings, I have one question coming in from Ryan Lynch with the Orlando Business Journal for you. Do you expect the ramp up in flights at OIA to positively impact local businesses, or do you expect it to take some time before that translates to more business here?
I think as the flights uptick here at the airport, it translates into more business for us as a community. It certainly will result in positive economic recovery for us. So on June the 4th, we will be doing the State of the County. We will have a live audience for that, and we will be doing it virtually. And at that, we will talk to our community about the forecast, what we see. We'll talk about where we've been and where we're headed as well. So I encourage all of you who can to join us for the State of the County on June the 4th. And so with that, do we have any other questions? Okay. Well, let me just say thank you to all of you for your journey out to the airport to join us today. Thank you to Mr. Brown and the airport staff again for hosting us here. The next briefing, believe it or not, there will not be a briefing next week. This is number 134. The next briefing will be on June the 2nd at 4:30 at County Administration. So thank you all.
And we could be at 5% of the
And we could maybe be at 5% or below.